Hi, my name is Holly Campbell, and I am going to talk to you about conflict in the workplace. You will also see a small skit of a conflict that I have had during my nursing career. A study of new nurses stated that at least 90% of nurses have experienced some form of lateral violence in their workplace. Lateral violence is an RN acting towards another staff member in a verbally, emotionally, or physically abusive way. It can be something as overt as a shout or blame, or a little less overt, such as a gesture of rolling the eyes, raising the eyebrows, making faces, or even anger gestures for that matter. The American Nurses Association states that lateral violence and bullying have been an issue and concern for decades that have had a negative effect on the individual nurses, the workplace, and the profession. This video will demonstrate a conflict between nurses while giving bedside report. One moment as we set up. Thank you. This is our skit. Miss Smith, this is your new nurse, Betty Sue. She will be taking care of you as my shift is now over. We give bedside report. What that means is we will go over your history and care here at the bedside. Feel free to jump in and let us know if we have left anything out. This is Miss Smith. She is a G1P1 now, had a sterile vaginal delivery at 1400 with a second-degree laceration with repair. She pushed for an hour and is a little edematous. Her lochia has been moderate to heavy, small clots, and her fundus firm at U but slightly to the right. She had a baby girl, would like to breastfeed, and has plans to see the pediatric center. She has no medical history, and the only surgical history she has had is her wisdom teeth removed when she was 13 years old. She has been up twice, and she has voided twice. I have not removed her hep lock yet because her bleeding has been more than I liked. You haven't removed her hep lock yet? If she has voided twice, you can remove it. You know this is policy. If the feeling in her legs are back and she's voided twice, there is no reason for it to even be in, even though you feel like her bleeding is more than you like. Well, yes, this is usually what we do, but because of her bleeding, I felt as though leaving it in until it lightens up would be better, just in case she needs some extra meds for the bleeding. I can gladly give the doctor a call if you would like me to. Well, that's just one more thing I have to do with the other 4 patients I also have. This is the beginning of my shift. No, you don't have to go the extra mile and call the doctor. Our policy supports it coming out. Would you like to come talk outside? That is not necessary. Betty Sue, I would have removed it, but her bleeding was more than I was comfortable with. Because her uterus was at U and slightly to the right, I thought I would wait. Her vital signs are stable. Maybe you want to take a look yourself and decide what you would like to do. I don't have time for that. Like I said, I have 4 more patients to get report on. Please, just go remove it. And Miss Smith, I will be back in a few. I have a few other patients I have to get report on. If you need anything, you can just hit your call bell. And if I can get in here, I will, or someone else will. Bye. So as you see, that was our skit of some conflict in the workplace that I have experienced. Communication is required to provide safe and quality patient care. Well-articulate and deliberate strategies should be in place to navigate our difference of opinions. Joint Commission cited that intimidating and disruptive behaviors foster a poor work environment and results in poor patient satisfaction. It only takes one difficult person to cast a wall of dominance. In this situation, I would have stepped outside the patient's room if I had an issue that needed to be addressed with that nurse. When the primary nurse tried to ask the oncoming nurse to step outside, she said no when she should have agreed. It is not just what is said, but in the manner than what it is said in. Betty Sue should have never discussed a conflict in front of the patient, nor should she have disclosed that she had a heavy assignment. That is something that we just don't do. Betty Sue overall's attitude was poor. Her increased tone, her body language was stressed, angered, and she was abrupt in front of the nurse and the patient. The situation can be seen as lateral violence in nursing. conflict and criticism. This is very counterproductive. The book discussed the nurse-to-nurse relationship and how there are occasions of unpleasant interactions between colleagues. It is important we work together and we are advocates for our patients and ourselves as a nurse. Collaborative teamwork is a joint problem solving that produces desired results. In turn, it helps maintain a peaceful relationship. We need to work together in the best interest of the patient. Thank you, and I hope you enjoyed it.